All right. Hi, everyone. I'm Bethany Hamilton, co-director with the National Center for Medical Legal Partnership, and I am joined by one of our favorite MLP experts in the field and supporters, not just in medical legal partnership, but really working on a social determinants of health. I am here joined by Dr. Eric Elbogen, and I'll ask him a few questions really to get a better sense of his research, what it is, how it's applicable to the work that you all have been doing, and then really how he's been powering through a really difficult year as we all battle COVID-19. Thank you and welcome. Thank you for joining us, Eric. Tell us a little bit about yourself and your research, what you've been focusing on.
Thank you so much for having me. I have been doing research looking at the link between financial well-being and clinical outcomes like suicidal ideation, suicide attempts, and looking at how there are social determinants of suicide and also violence to others. That suicide is not just a medical problem, but it's also a social problem. And that actually, I began to see that. I worked as a case manager for people with mental health problems over 25 years ago and began to see the effect that mental health laws were having on people's lives. So I went to the law psychology program at the University of Nebraska and have been doing research looking at how the law has impacts on people's lives, looking at representative payees, psychiatric advance directives. And I began to look at how money management in veterans, and I ran a money management group for over a decade with veterans, beginning to see how financial well-being was impacting on veterans' lives. Beginning to see that it had links to outcomes, including mental health problems, but also suicide risk. So that's where a lot of my research has gone, developing with the Department of Education a curriculum for veterans to do better money management. It's called SAFE, Steps for Achieving Financial Empowerment, and looking more recently at the study this year in the US population, the link between financial strain and suicide attempts.
Let's talk a little bit about that study that you just mentioned. First, that link that you examined between financial strain and suicide attempts. I understand you and your colleagues in the field of research put out a study recently, and we'll provide for our audience a link to that study so that you can take a look at it for yourself. But tell us a little bit about what your abstract was about. Why was it necessary, and what did you find?
So one of the reasons is there's a lot of research that had shown that during the Great Depression, the recent recession, that there were correlations with higher suicide rates. And so there has been a lot of research that's shown this connection between homelessness and suicide rates, or unemployment and suicide rates. But one of the things that a lot of that research did not do is it didn't control for mental health problems, past suicide attempts, substance abuse. So it was always, and a lot of that wasn't longitudinal. So you didn't know if someone had financial strain at time one, whether or not in the next few years they had suicidal ideations, suicide attempts. And there was this national data set available. We started this analysis before the COVID pandemic, and it was published during it. But what we want to look at is not just one aspect of financial strain, but was combining financial debt, unemployment, past homelessness, and lower income. Did those cumulatively link to increased risk of suicide? And it did. When you control for those clinical and demographic variables like depression and past suicide. So what we showed is that, in fact, people who had debt, had lower income, had past homelessness, and were unemployed were 20 times more likely to attempt suicide in the next 3 years compared to people without those 4 financial risk factors.
Wow. Very important body of research. And it's jarring to hear those findings again. Because of that effect, right, reading it, what can we make of it? In other words, for MLP practitioners and policymakers, we look at the body of research, and often research can be pretty dense. For those of us not in the research community, what can we make of it across disciplines? Medical legal partnerships, as you know, involve not just legal services providers and clinicians in the medical field, but often invite, as they are instrumental in carrying out that social determinants of health intervention, community health workers, patient navigators, and many types of disciplines are involved in these partnership collaborative efforts. In the policy space, your policymakers may be looking at the study that you and your colleagues put out. Now that we are in a crisis, both public health emergency caused by COVID, and then all of its effects, housing insecurity, economic insecurity because people lost their jobs again, and their incomes were already pretty tight and unstable in wage-based jobs. What can we make of this research?
Well, I think the first thing is that the data supports the efforts of medical legal partnerships in their interventions in the areas of income, housing, education, legal status needs, and personal and family stability.
Mhm.
I think that this directly shows a link between the very interventions medical legal partnerships are trying to intervene on, and those efforts could lead to downstream prevention of people being in situations where they may feel suicidal. And there was another study of veterans this year these are not, this is not colleagues of mine, but other researchers showed that the time that veterans were at highest suicide risk was right before eviction.
Hmm.
And so thinking about the kinds of interventions medical legal partnerships have, it's definitely consistent with this research. So I think for policymakers, suicide is a medical problem. Psychotropic medications and psychotherapy for mental health problems, substance abuse are critical. But those could be supplemented with job retraining, vocational rehabilitation, housing assistance, helping with education, financial support systems, services, financial education, debt management. That's, I think, one of the take-home messages from this research is that in terms of implications, that suicide, because there are the social determinants that are leading to increased suicide rates in this data, and it's a nationally representative data set
Mhm.
of the United States, that would be something that's really a take-home message, that those are areas you could expand the kinds of interventions that might really be important for suicide prevention.
Agreed, agreed. So, Eric, it has been, aside from the research, a really long year. And for the research community, you all continue to churn out data and studies and really look at some of the toughest issues that we face. For the research community, could you provide any nuggets of advice and tips for those who are everywhere from like experienced researchers to students perhaps that are exploring exactly the types of issues that you are into right now in your career. Tell us how you're remaining focused on the road ahead, and how would you advise those in the research community about how they can continue to remain focused on the social determinants of health? Are there some guiding principles that you apply for even reimagining research?
Sure. So I the idea of looking at social determinants of health, I think financial issues don't occur in a vacuum. They occur in a social environment, in a legal environment, and to begin to look at the different aspects of those in people's lives, and I'll give you an illustration in a second, is really critical. So with veterans, we also recently published a study showing that it is a combination of veterans feeling financial well-being, social support in their lives, spirituality in their lives, having jobs, vocational, those different dimensions actually translated to reduced risk of suicide 1 year later. And so I think a lot of interventions focus on symptoms, mental health symptoms. I think those are really important. But it's also important to look at psychosocial functioning. And if there's a model, and it's called psychosocial rehabilitation, it's looking at how people function in their living environments, like housing stability, in their working environments, their work, their financial situations, their spirituality. And those actually, and I've done that with research on veterans, other people have done it with non-veterans, and those are all contributors to lower risk of suicide, and they're cumulative. So it begins to accumulate. So the more that you can help, and researchers begin to address those different areas, and that's what's so exciting about medical legal partnerships, is that you're actually addressing these multiple domains of income, housing, education, legal status, personal and family stability. I think that that's, you know, those are all related, at least our research with veterans, to reduced odds of suicidal ideation. So that's really exciting. I want to mention one last thing too, is one of the factors that we found that relates to reduced risk of suicide in veterans is a sense of self-determination, and a feeling like one is in control of one's future. And I feel like a lot of the reason why people might be seen in medical legal partnerships, because they're struggling with just feeling out, like those are situations in their lives where they're feeling out of control. And so I think that the issue of feeling in control and helping people feel in control by helping them achieve what they want to do in their work environment and their financial environment. So it's not just helping people have better income or have housing stability. Also, that has the side benefit of helping people feel more self-determined. Advanced directives are another example, where those laws are exactly meant to be about self-determination. So those are other areas that I think it's really exciting that medical legal partnerships are working on, and that link to the research that we've been doing.
Eric, we greatly appreciate you sharing your time with us today. I am always fascinated by what researchers like yourself continue to take their dedicated time and skills to really help us who are applying the data and the approaches in the field to really prove the value and impact of every day for the patients and clients that are served by our organizations and our efforts. How many folks, if they'd like to find your research or look you up, find that? I know of course, there's a way to Google search you, but would you like to share some information briefly so that folks know where to find your research?
Oh, just feel free to email me. Yeah, if you Google, you'll find me pretty quickly. So yeah.
Thank you so much, Eric. Thanks for joining us today. We wish you well. We want to thank everyone who has viewed our 5 questions interview series to join us in the future for additional interviews of medical legal partnership experts and those who are working on the social determinants of health around the country. Thanks for joining us. We'll see you again.